Okay, there we go.
Okay, welcome everybody. I will turn it over to our President and CEO, C. Marie Taylor.
Good morning, everyone. So nice to know that you're in our presence. While we can't see you, we feel your energy, and we're excited about this hour. We've got some awesome ladies on our panel today. So as you know, this is our Leadership in Action series, and today is about nonprofit collaboration. So we're going to talk to some experts in the field who are in for-profit and nonprofit who are working together and learn about how they are working in this time of pause, as I'm calling it and claiming it. So I'm going to do a roll call. They're going to wave. We're all going to wave at you all. They're going to say a little bit about themselves, and then I'm going to roll right into the questions. And then Carmen is going to help us with Q&A right after we answer a couple of the few questions. So this morning we have Jennifer Hester, who is for 2017, and she's on our LM board. She's the Vice President of Human Resources for the MS Corporation, the MS Company, and she is super excited to be here. Jennifer, tell us a little bit about yourself.
Sure. Well, I guess I'll start with yes, I am super excited to be here and representing, of course, the best class of 2017 for LM. You know, I work as part of, Maryland's there too. I work as, part of a clinical research organization. And, we are excited about the fact that we get to make a huge difference when it comes to the public health of our communities, including dealing with things like pandemics, as well as things that, are also relevant to our community and helping our nonprofit organizations that are also serving in the same area. But I've been with MS for 16 years now, helped to support the overall employee engagement, and of course, serve in the capacity of leading the team that puts together our nonprofit initiative so that we can continue our mission of help with public health.
Thank you. Sure. All right. And so next we have Amy Javid. Did I do it right?
Javid, but that's perfect. That's fine.
Right. She is the Vice President, Senior Vice President at Wider Circle. And so we're super excited to have you here. Tell us a little bit about yourself.
Well, thank you for having me and for hosting the important dialogue. My name is Amy Javid. I'm the Senior Vice President at a Wider Circle. As you all know, we do kind of a wide array of things with a lot of different partners, profit and not-for-profit, across the region. But one of the key things is we really work with marginalized groups, specifically those living in poverty. And at this time of crisis, those groups are particularly marginalized and really feeling the brunt of kind of the strain and the suffering and the scarcity. And so it's really important to be parts of these types of dialogues, to talk about coming together, talking about partnership, and talking about both short and long-term solutions so that everyone can be part of the recovery.
Thank you. And next we have Marilyn Link. She is CORE 2017 and actually our LM board president. She's the executive director of equity, diversity, and inclusion in human resources. Long title, Marilyn, at Adventist Healthcare. Welcome, Marilyn.
Thanks, C. Marie, and I'm glad to be here to serve with panelists today. I have been at Adventist Healthcare for about 15 years and have always been interested in equity, diversity, and inclusion. In my previous role, I actually worked quite a bit on nonprofit collaboration with our community-based and faith-based partners in Montgomery County and also Prince George's County. In my role, I get to focus quite a bit on meeting the needs of the patients that come to our hospitals. We are an integrated healthcare delivery network of hospitals, home care services, imaging. We also have urgent cares. And so as you can imagine, we serve quite a wide community of people as our patients and clients, but we also have quite a large workforce that also reflects the diversity of the population that we serve. So we want to make sure that our community partners, especially at this time, have the resources and support that they need to meet the needs of organizations, especially organizations, but also community members, especially communities of color. that are disproportionately affected by COVID-19. So I look forward to hearing from our fellow panelists today.
Thanks. All right. And last but not least, we have Susie Sinclair Smith. She is CORE 2014. She's the Executive Director of Montgomery County Coalition for the Homeless. So welcome, Susie. Tell us a little bit about yourself.
Thank you, C. Marie. And the title of this session couldn't be more appropriate as I look at my sister speakers. The head of Adventist Healthcare is on our board of directors, and you've been incredibly helpful to us throughout this crisis. EMS has been a wonderful supporter of ours, both financially and in kind. Leadership Montgomery has done multiple projects with us, and a wider circle has been a critical partner for us as we serve people. So thank you all. This has been a really challenging time for the population who experience homelessness in Montgomery County. The Leadership Montgomery's focus on issues of diversity are just front and center to us right now. While the African American population makes up 18% of the population in Montgomery County, it makes up 68% of the population who are experiencing homelessness in Montgomery County. The plethora of information that's coming forward about why this particular population is really at a much higher, 56% likelihood of dying from infections is coming to bear for us right now as we see the intersection between homelessness and public health in a whole new light. Montgomery County Coalition for the Homeless, we have two different types of programs. One is emergency programs. So we run the Maine Men's Emergency Shelter Program now. We've expanded our shelter to serve 200 men now in 4 different locations. We also move formerly homeless households who are the most vulnerable into permanent supportive housing. So we support them while they are in their housing with our case management. We are seeing both the challenges of having to protect the health and safety of our staff and clients in congregate shelters, but also our households in permanent supportive housing are extremely vulnerable at this time. Unfortunately, we have seen a number of overdose deaths lately. We have both staff and clients who have tested positive. We are now, I've been working in the field of homelessness since the mid-'80s, and at that time we were just focused on making sure everybody had emergency shelter. We're now taking people's temperatures, isolating them, quarantining them, playing a real public health role. So we, and I don't mean to go into the future questions, but that's, I was also, the federal government produced the first federal strategic plan to end and prevent homelessness in 2010. And I was an expert consultant at HHS at that time to help put the plan together. There was no information at that time contemplated about the public health aspects of homelessness. So I think we are in a new time right now. And thank you so much. And 2014 was an awesome year in Leadership Montgomery.
Thank you. So part of your answer reaches right into what we wanted to talk to next. You really kicked us off because what we want to hear from you all is how, and we've heard some from you about how you had to change the way you operate and some of the ways that businesses had to pivot in terms of their strategy and collaboration with other organizations. So I'm going to pivot over to Amy, then we'll go down to Jennifer, then Marilyn, we'll come back up because it's going to go on my screen order. So Amy, talk to us about how your organization how this current situation has changed the way that you're operating.
Sure, thank you. Normally, as many of you know, we operate a very large center in Silver Spring. We furnish 20 homes a day, host 30,000 volunteers, and then have innumerable staff and clients walking through our spaces. We had to shift to remote working because we typically had hundreds of people in our space every day, and they were not people that regularly interacted with each other. And so in that shift, there were a couple of key themes that we needed to think about. One was really ensuring connectivity, and that was among staff members, among other key stakeholders, including nonprofit partners, as well as our clients, and thinking about all the different things that we needed to do to ensure that level of connectivity, especially with those that we serve, and doing as many calls and webinars and all sorts of things with them as possible. And then the second part was really around engagement with the array of stakeholders that we work with regularly. And so we've done that through a variety of letters, listservs, blogs, but also through hosting town halls. We had our first town hall earlier this week. Those will be a monthly thing where we can talk about some of the key issues. We typically had a race to end poverty. We've switched that to be virtual and had a month-long call to fitness and activity, culminating at a date in mid-May. And through this, we've had a really unique opportunity to dive deeper into connectivity with our clients and our stakeholders. We've been in touch with more than 4,000 clients via phone calls. Some of those phone calls started off when we were open at about 10 minutes because a lot of them were kind of appointment updates or appointment confirmations. And now they're really long opportunities to connect and understand the concerns and the needs. And in doing so, we've developed an array of resource guides for services across the county. So as folks call us or as we call them and they have a question or a concern, we have a place to point them to. The same thing is true for our volunteers or for those who would like to make product-based donations. We are well aware what other partners in the county are at a position to accept some of those things and or distribute them. And so while there is a shift away from kind of the product distribution or having our Silver Spring Center open, those two core goals of connectivity and engagement remain and are really kind of those driving lights for us as we move forward in this very trying time.
Thank you. So in that vein of connectivity engagement, MS Corporation does a lot of that in terms of your partnership with nonprofits. So I'd love to hear about how you've had to change and pivot that work and even your work for your actual business.
Yeah, absolutely. And, you know, being able to support nonprofits and continue our partnerships with them is actually, we consider to be an integral part of our business, even though we are not a nonprofit. You know, MS's expertise is in clinical trial management, and, you know, our clients actually are government, you know, mostly government institutions like NIH that we are partnering with their scientists in order to run to manage clinical trials on their behalf. And so there was a lot of course, professional and personal satisfaction that our employees draw from that. When we had to make the change, and it was of course quickly, as we all know, to work into a virtual environment, we had to think about our over 700 employees that are predominantly located in an office building, you know, in Rockville, Maryland. And then we also had, so we have over 400 employees that were, you know, used to coming into the office, even though we had a robust, you know, telecommuting and remote working program in place. People really enjoy coming to the office in order to be connected. We also have offices in Frederick, Maryland, Tysons Corner, Virginia, and then we have two other businesses, one in Canada and the other in India. And so as an organization that has always found enjoyment, engagement through collaboration and through the ability to help everyone within the community from a public health standpoint, not just through our client interactions, but also through our interactions with our nonprofit partners, and continuing to have programs running like our employee volunteer committee, which is a extremely important part of the organization. We had to figure out how can we maintain this while moving everyone into a telework environment simultaneously. And I think the reason why we have been very successful in being able to do this is because we have always been a very employee-driven organization, and having things within our organization like an employee-run volunteer program has helped us have lots of hands, lots of brains, you know, going to figure out how can we not only maintain our partnerships, but also increase them. And, you know, I'm really happy to say that we have been able to continue the partnerships and the projects that we've had. I know that we work with Comfort Cases. We, you know, work with the coalition, you know, for the homeless. You know, we've made, you know, things like lunch bags for them before. You know, we still do have our partnerships with like the Wider Circle and others that, and as they've moved to a more virtual environment and they're doing virtual fundraisers. We have one, with the Treehouse also, that's coming up, their Sweetest Bike Ride and the Wider Circles Race to End Poverty. We've been able to promote those by using our employee volunteer program, by using our intranet, by using emails that are going out. And then we also have used our business mechanism. So we have on a weekly basis, which is actually the reason why I'm going to have to leave this meeting earlier than I would like. But every week on a weekly basis for an hour, we speak to our employees. We have a virtual all hands meeting. And it's just great to see that unity of having practically, 90% of our employee population logging on. We've been fortunate to be able to maintain 100% employment for all of our staff through this, and then leverage it to help our nonprofit partners. So we always also speak to the nonprofit events that are coming up and how employees can participate in those, along with what they can do from their families to also maintain health and wellness for them, engagement and collaboration for them, and of course, sharing that with our nonprofit partners, and of course, having organizations like, Leadership Montgomery CVC program to also help us understand what other needs are, how we can further develop our program and maintain it throughout this time period.
Thank you. Yeah, so Marilyn, let's hear how you guys are maintaining and moving and leveraging and operating in this new environment.
A very, very new environment for healthcare and hospitals across the nation. So I'll talk about our hospital overall operations, but also what we've been doing from a leadership standpoint for our teams, our healthcare professionals, and then for the community. So at Adventist Healthcare, we have over 6,200 employees. That doesn't even include the volunteers that we've had, the providers, medical providers, or partners at practices in the community. Usually we have about 750,000 discharges every year from our multiple acute care facilities. As you can imagine, operations have changed dramatically. We've gone to non-essential procedures, limiting visitors, but there's definitely a need for more support and supplies for staff. So we focus quite a bit in our operations, as we always have, but definitely to a greater extent now, implementing safety measures, because we want to make sure that our staff, that our providers, and the community remain safe through this COVID-19 pandemic, and make sure that people who need access to healthcare or to some of the services that are provided by our community partners, that they have that access. So one example is that we now have remote therapy and remote urgent care visits, so that people can use telehealth or televisits to still get care, to identify if they have COVID-19, et cetera, and then help them through a process. So that definitely has changed how individuals interact with the healthcare system, and I think that will continue into the future. For our leaders, we have certainly been trying to not inundate people with too much information, but make sure that we've got simple and regular communication going on, both internally and then also with the community. So our leaders, we communicate, of course, with local officials to keep up to date with the constantly changing numbers, information from the health department, both locally and also at the state level, our Maryland Hospital Association as well. And we really focus on trying to make sure people know how we are here to help serve both the employees and the community. So similarly to what Jennifer was saying, we have people working remotely via Skype, video and audio meetings. We've got definitely telehealth, which we've had a process in place for telehealth for a while. So that has certainly been important to have that policy in place. We have daily COVID-19 updates, so people know what to do, what they need to know, how they can help, and to, of course, make sure that they're practicing safe practices like social distancing, washing hands, et cetera. One thing that we have been talking about for how teams can be engaged is thinking about how they can take a different role. So in our organization, we're doing our best to keep people employed. And so that we may have shifted roles brought in people who may be in administrative positions into the clinical positions, providing them with the training and the resources that they need so that they can be effective. And then also talk about volunteer opportunities. So we have reached out to our partners at Leadership Montgomery, Corporate Volunteer Council. We've also reached out to a lot of our key partners who are addressing things like housing and homelessness, food access, and mental health, so we can understand what their needs are now, and then engage our employees by letting them know, here are ways that you can volunteer. In some cases, non-contact volunteering is an option, doing things virtually, or even donating your, donating money is another option. And so we want to make sure people are engaged in the response. They even can take roles internally in a call center, so that if there are calls from the community, that we can field those calls and let people know, here's what Adventist Healthcare is doing in the community to address some of the changing environment. I would definitely say that we are focusing quite a bit in our communication on personal protection, but also mental health support, because we know this is a challenging time for both people in our organization and in the communities that we serve. And so finding ways to provide them with employee assistance, giving them inspirational quotes. We've got several leaders who have done videos over the last several weeks to really show thanks to our healthcare providers who are taking risks every day to be out there and serve our community, but to also recognize that there are so many people that are adversely affected by COVID-19, and just to be sensitive to some of the needs that are happening in the community. And just one last thing I want to say is that we are a community-based organization, and we're also mission focused or mission driven. We have a faith mission at our organization, and so we really focus on making sure that we show gratitude and thanks to those individuals who are in all kinds of positions in our organization, and try to be inspirational as well. So we have hotlines, a spiritual care hope line, there's a community hotline, an employee support team call center. So lots of ways to just keep communication lines open, and also for our patients, making sure that we are finding ways to make referrals to help meet their social and economic needs. Mm-hmm. So we know that going back after receiving care at one of our hospitals, that going back to the community, that they may need more support. So we make sure that those referral lines are open as well.
Thank you. So Susie, I'm going to have you, I'm going to put it in question 1 and 2 together, because I was going to call on you next. Because I think we've heard a lot about how we're taking different roles, showing some gratitude, thanks, how we had to switch to remote where you can. However, particularly for you, some of the work can't be done remotely. And as you talked to before about you're in the front lines of healthcare, and never before was there a crisis plan for this public health piece. And so the question I have for you is, talk about what kind of crisis plan did you have prior to this? What did it look like to maintain your basic operations? And how has that plan changed? How has that plan changed based on how you're operating now? You're on mute. Susie, you have to unmute yourself. We want to hear all your great words.
When I started at MCCH 9 years ago, there was a crisis every day that I was managing. We serve 1,700 men, women, and children, and they are the most vulnerable. And we early, I'd say within 3 years, realized that it was part of our business model. It wasn't something that was happening to us. So we have developed crisis protocols for our organization, sort of identifying what the level of crisis is, who makes a decision, and who, when do we communicate. So that has been very helpful. When this unexpected, I reached out to the Director of Health and Human Services at the end of February saying, are there any protocols? What are the plans? And we have been getting ongoing guidance from the HHS public health officer as well as CDC that changes pretty much. So part of our partnership with the Department of Health and Human Services, who funds us, we developed something called a COOP plan that was, what is our plan for responding to this crisis? And we developed it both for our emergency shelter staff and for our emergency shelter programs and for our permanent housing programs. It's been interesting. We got phenomenal news yesterday, and I saw a picture of Governor Hogan and his wife at BWI welcoming some testing kits from South Korea. And following up on that, we heard that the state will be sending teams of both public health workers, both in the primary and behavioral health care. And we're requesting 2 teams in Montgomery County to come to the shelters to help us do testing to assess for behavioral health crisis needs. We have been learning how to be adaptive on a daily basis. And I think I'll go to what Marilyn was saying. I think what has made us the success we've had to date is because of our passion for our mission and our clients. We will do anything that we need to do. We did realize early on, so that's, I will definitely speak to that. We realized early on we are have 160 staff, a $16 million organization. 75% of our funds come from government sources that we have to continually submit invoices, report on. And for us, we identified early on, it was critical for us to be able to maintain our business operations. So we created a structure we started teleworking, I think in mid-March, but we identified essential staff who needed to be in the office. I've given them authority to use my signature stamp. Probably shouldn't say this publicly, but I'm in that older age group. But that has worked well. We are a very high-touch organization. As I said, we serve 1,700 men, women, and children each year, and we are a direct service organization. We realized that our staff who needed to continue providing direct services, such as healthcare workers, like Adventist is working with, we needed to get them as much protective gear as possible, as much sanitizing agents. So we really drilled down on making, just like yelling from the rooftops that we need additional protective gear. We were very grateful that a doctor from Adventist Healthcare came out and assessed our shelter, gave us recommendations of how we could function better. We do have clients in crisis. I talked about the behavioral health issues. Many of our clients have behavioral health issues, substance use issues. The county's mobile crisis team stopped operating. So our clients in permanent housing have case managers who actually go to their homes to help support them. So our case managers are now providing kind of case management and educating our clients about best practices for them to stay safe. But we formed something called a VCAT team, which vulnerable client action team. And it's with our high-level clinicians who are very skilled in behavioral health and have health backgrounds, and they are responding to emergencies and going out. So when we do get N95 masks or those sorts of protective gears, we've been saving those for the VCAT team. Our VCAT team is now able to emergency petition people who are in psychiatric crisis, who need to be, have an inpatient psychiatric stay to help. I also, let me see. Our healthcare provider, Cornerstone Montgomery provides on-site behavioral health services at our shelter, and Mobile Med and provided primary care services at our shelter. They have now both switched to telehealth, so it's not that direct touch. So that's great, but we also have been having to develop the capacity as the organization that runs the shelter to know how to implement the telehealth on the other end. So I think that's going to be a lasting sort of legacy, which is great. I mean, I think there are many. And I just quickly, I do want to commend, we have been switching roles as well. I mean, we have been reassigning people, and we send chocolates to our shelter staff. I send them zinc lozenges. I'm on Teams meetings with them. We do all we can to keep up morale and show deep appreciation.
Yeah. Well, and so that's a great pivot over to you, Jennifer, in terms of morale, because you're in charge of human relations. That you've got, as you said, hundreds of staff kind of spread out around. And so do you want to talk a little bit about how you've had to pivot and change what your crisis policies and plans were, what they look like, and any changes you've had to make recently?
Yeah, I think, you know, as opposed to using the word pivot, I think it's really just more implement and expand and, you know, make, I think, I don't want to use the word customize to the situation. So as much as you can plan, as much as you can think about what may be coming down the road, every situation is extremely unique. You know, coming from an organization that does clinical trials, not just for highly infectious diseases, but things from maternal fetal medicine, oncology, you know, ophthalmic studies, you name it, you know, we've become very aware that there are populations, you know, all over, certain populations are affected differently based on, you know, gender, you know, based on where you live, based on your socioeconomic situation. And, you know, we're fortunate that this company, MS was fortunate just to have that general wherewithal and try to then also apply it to our own employee population. Our own employee population, you know, most of them have, you know, degrees, master's degrees or higher. But every employee is unique in terms of what their individual needs are. So, and, you know, keeping up morale, keeping up with what it is that's needed so that they can continue to fulfill their role, which is actually critical to the health and welfare of our community, you know, not just locally, but also on a global basis when it comes to dealing with pandemics. Maintaining a work situation where, yes, recognizing, you know, they are working, you know, 13, 14, you know, plus hours a day, trying, for instance, to set up, you know, study sites and clinic sites so that our scientific partners can conduct, you know, some very important trials, trying to make sure that they know that they are, you know, continue to feel that recognition through many of the things that, you know, Susie just mentioned in terms of just the small things. You know, the words, of course, words go a long way, words of kindness, check-ins, making sure that from a team perspective, having even things like virtual coffee hours or, you know, happy hours if the case is also needed. Making sure that you're continuously, now more than ever, just reaching out to people, individual staff, supervisors to employees, encouraging peer-to-peer connections. We do a lot of things internally, like, you know, posting, you know, celebrating and making the most of the situation that we're in. We recently had something where it was, you know, everybody in our company has really wanted to bring your pet to work day. You know, people wanted to bring their dogs and things.
Right. Oh, I like that.
Which we haven't been able to do, but we did do a bring your pet to virtual work day. And so we set up through our wellness portal, because we have that as part of our partnership with our healthcare provider, a portal that not only can employees go on to get and participate in individual challenges for themselves and for their families, walking challenges, virtual biking challenges, eating challenges, sleep, sleep, which is really important, sleep challenges, but also they were able to take pictures of their pets in their new home workplace and post them on the internet. And that's just something that, you know, is something that is lighter. It was great to share that. So again, leveraging things that we may have wanted to do in the past, but for whatever reason, you know, including not able to bring all of our pets into the office, we can, you know, show them off and talk about them now. So that's just an example. The other thing that we've done too, from a leadership perspective, is again, share those personal stories. You know, it doesn't matter, again, where you are in terms of your work situation within your organization, we all are having to make the best that we can. I mean, I shared a story because, my, the staff, the employees, we're trying to figure out how do I, work with the equipment that I have at home. And I just talked about the fact that, I have a 10-year-old, laptop that I've got open for video. I have another laptop, from that I took, when I left the organization, because I have a laptop that I use there, for data, and I'm, that's my dual monitor, and it's stacked on top of a whole bunch of magazines, with, my middle schooler, within eye shot and earshot in the kitchen, doing homework, so I can go and help them, and my high schooler, working remotely from her office in her bedroom, doing her work, and just really trying to connect with their staff and allowing them and making sure they understand that you are doing the best that you can. We're not expecting, our expectations about how we present ourselves. We still want to be professional, but, we understand if all of a sudden here comes a cat jumping on top of the, jumping on top of the table or something else. And
Right.
This is one situation where we are all working in that same kind of, everyone, your clients included, are working in that same environment.
Right. And I think it's an opportunity. I've been talking about this a lot in these webinars. It's our opportunity for some more grace and gratitude.
Yes.
Right. And so I hope out of all of this that we always have just a little bit more grace and a little bit more gratitude. Right. So that's one of my hopes for this time of pause. And so, Amy, I'm going to pivot over to you, because we don't know how long we're going to be doing these webinars. We don't know how long we're going to be working from our households, right? And so we've talked a lot about this, and this is a kind of recurring theme that we're asking our panelists is you have to stay present and future focused, right? And look at the short term and long term. And so for a wider circle, what are some of those short term things that you talked about, I think, in the long term? And what's that looking like for you all right now?
Sure. And I think it's a really important question for all of us to think about, because we are kind of in that crisis mentality right now, but at some point we'll be shifting kind of to the recovery mentality. And so there are very different responses and strategies that need to be employed, I think, on both sides. I think right now in the crisis mentality, it can bring a lot of concerns and a lot of anxiety. And I think Jennifer, for example, talked about the need to customize kind of the emergency response and to provide a lot of support. And I think that is true both internally and externally for us. The first and foremost thing that we need to do is keep our team whole. While some of the people have changed roles, there will be a massive demand for our services across all of the services we offer when the time comes that we are able to reopen. So some of those folks that might traditionally not have been behind the desk all day need to be shifting and adjusting. And so providing some extra support to them, but along with that extra support, kind of the ability to understand that we want to keep us whole, that we want to stay connected as a team, because as a team we came into this, and as a team we will be stronger when we come out of this. The result is that everyone has allowed a greater sense of flexibility in their roles and their duties and even their schedules. We were a 7-day-a-week organization before all of this. We still have staff that work across all 7 days. And so those sorts of things in the immediate term is really about staying connected and feeling supported. But I think in the longer and in the immediate and short term, it's also about what are some of the virtual things that we can do, virtual services, virtual learning. I was talking to someone earlier, we're going to start doing a virtual cooking class with one of our community partners. We did a virtual trauma and support discussion. We've done virtual things on job seeking and some of the challenges in the workspace, knowing that some of those will be concerns not only now, but in the longer term. And I think as we think about the longer term, we need to think about what all of those guidelines will allow for. In terms of the number of people who can come to our space, in terms of donations and how we deal with those, sanitize, how many clients can come in, and how do we balance the product-based things that we do with the services-based things that we do. Some of our services are very high touch, as folks mentioned, really sitting close by someone, working on a resume or working on an issue related to housing. And some of our things are product related. And so how do we balance what could we offer in maybe the medium term, and then what could it look like 6 or 12 months from now? The other big thing is we were planning to launch a national plan that was around engagement around all aspects of poverty. And we have pushed that off for a few months because we think as we learn more about the crisis and the pathway to recovery, that will help inform the plan and kind of prime the wheels for people to want to be engaged. I think a few of you have mentioned that it has brought new levels of engagement from across stakeholders. And we want to build on that energy and kind of strengthen that so that it isn't just for now.
Yeah.
It really is something, an energy that we can kind of keep going. That grace and that gratitude and that support is something that we would like to see continue and allow all of us who serve members of the community and of the county who are particularly marginalized at this time, that the recovery is one that works for them and with them in that long term, because some of the disparities that were present before have only been exacerbated. How can we look at them both from the individual level as well as the systemic level? So it really is a lot of thinking and questioning about processes, but at the same time still serving, and how do you balance both of those important issues?
Yeah, thank you. So we have some questions popping up in the Q&A, and I know that Jennifer has to hop off soon. So look, I'm gonna hold my last question. We're gonna see what some of these questions are from the Q&A so that we can get to a couple of them, because we have less than 20 minutes left, ladies. This is crazy.
There's a lot of good things to talk about.
I know. So our magic voice, I think Carmen's gonna give us our first question.
Sure. Good morning, everybody. Our first question, can you share with us how you have collaborated in the past with either a nonprofit or a business, depending on what you are, and how you plan to continue those collaborations both during and post-crisis? I know we've talked a little bit about this, but kind of thinking more future focused, kind of how you plan to continue those collaborations.
So I'll let Jennifer, I'll let you kick that off, and then maybe we'll pivot over to you, Marilyn.
Sure. So our employee volunteer program started about 2 years ago, and it just completely blossomed into being able to provide employees with a wide variety of service opportunities, including, as I mentioned before, working with the Coalition for Homeless to do things like make lunches, bag lunches for them. We've partnered with Wider Circle in terms of going actually on site there. And I'm speaking specifically to things that were high touch, going on site there to help them go through their, you know, the household goods and items that they have to donate to others. We help with Nourish Now, going on site, you know, to help with their food collection and sorting. So we were doing stream cleanups. We were doing, you know, on site all together, you know, a lot of these races and walks to help support. We were doing blood drives and actually having the Red Cross come to MS, you know, and employees would go and donate blood. And so most of the things, the majority of the opportunities that we had were very high touch, and looking now to how do we continue to have that same level of partnership, and I would say even a higher level of partnership now. This again is where having these employee volunteers and having these employees running things is so important, because employees hear of so many different opportunities through lots of different sources. And we were able to partner with a few of the organizations to participate now in their virtual races. And so we've gone from, you know, everybody going out all together to do this to you can now do these virtually. So part of the change has been, as the nonprofit organizations have found ways to help, you know, and have people volunteer virtually, staying connected through them with our direct linkages that we've made just from organization to organization, having employees and having a method and a mechanism, which we do have within MS, for employees who hear of ideas to be able to send them to the volunteer committee, has also been important in helping us to maintain that. And then of course, having organization partners like Leadership Montgomery CVC program, who also helps us think of additional ways that we can continue our nonprofit connections, like this, for example, this panel has also, you know, come into play. And so by having a variety of sources and mechanisms to reach out to nonprofits to stay connected and then to receive that information has helped us pivot from what was a very high touch situation to something that has become virtual, and even including things like having our employee volunteers build out. We have a online portal on our intranet that is dedicated to nonprofit work and service. And so having our employees volunteer actually spend time helping to build that up and communicate information out as well.
Thank you. So I'm going to let Marilyn answer the next question that we have in the queue, which Carmen's going to tell us.
You're on mute, Carmen.
I am on mute. I apologize. How do you develop a vision for equity and create strategic messages to articulate your organization's values and goals, particularly during this crisis?
That is a great question. I definitely think you have to start out by what Susie said earlier, which is really the foundation of the mission of your organization. And so as I mentioned, Adventist Healthcare is a faith-based organization, and our mission is to extend God's care through the ministry of physical, mental, and spiritual healing. And that means that we extend this care to everyone, no matter their race, color, ethnicity, nationality, sexual orientation, gender identity, etc. And so when we think about equity, I think the first thing is really to, in order to have a vision around that, is to be aware and to build awareness about the inequities that are occurring right now. So we've had for many, many years, historically, inequities, structural racism, bias and discrimination that has disproportionately affected communities of color, people who are disabled, people who are gender minorities. So it's understanding what some of those disparities and inequities are, and then trying to think about how do we make sure that we are living out our mission and demonstrating it through core competencies, especially leaders demonstrating and modeling those skills and abilities based on knowledge and awareness of what the needs are in our community. So I think that certainly is one thing, and we are working very closely right now with Leadership Montgomery and the Real Inclusion program to develop a strategic plan ourselves that really highlights some of the points that I'm making right now. So the vision is, it has to come from leadership. So communication is also very important, and being able to think about what are we trying to do both internally within our workforce. So being not only diverse, but also inclusive in our workforce, and equipping our workforce to be able to provide care that is patient-centered, that is culturally competent and equitable, so that the outcome, the health outcomes for both the patients and the community are really what we're trying to achieve. In that vision, I think you also have to have very concrete strategies and objectives that may focus on making sure that you have access to the data, that you assess perspectives within the organization, that you are looking at your existing practices, policies, programs, and identifying whether they are equitable or inequitable, and then trying to work together collaboratively with leaders across the organization and with frontline staff to establish a plan to address any inequities.
Thank you. Yeah, and so I'm going to call on you, Susie, because I know you're also another MCCH is another participant in our Real Inclusion program, because we really felt like at Leadership Montgomery, we have this crazy microcosm of people of color here in Montgomery County. There are actually more people of color than white people in Montgomery County. And we needed to do some work around how leadership shows up, what it looks like, and how you have these programs and policies that are affecting people of color, right, that may be steeped in racism, right? Whether you knew it or not, and how do you address it, and what do you do around that? So we're really proud to have folks like Adventist and MCCH to participate in this class. And actually we're kicking off another one in June, because we know this is top of mind right now with COVID-19. And if you look at the stats and how it's disproportionately affecting folks, it's something we have to talk about. We just have not wanted to talk about. I see some head nodding. So I'm gonna stop talking, let Susie jump in a little bit, and then Amy, I'll give you the next question. And I know Jennifer has to jump off in a second.
Yeah, I'm actually gonna say,
Bye, Jennifer.
Wish everybody the best and to stay safe. And again, to say thank you for this ability to collaborate and continue the partnerships, which ultimately will help us all be successful. So thank you.
Thank you so much, Jennifer. We really appreciate everything that you and your company is doing for the community.
Yes, thank you, Jennifer.
Thank you.
Okay, now, Susie, we're going to pivot
I'll
over.
be real quick. I think we've all known that the experience of homelessness is a result of decades of discrimination against particularly the African American community in terms of redlining, I'm speaking to the choir here. And we are I'm a commissioner on our Interagency Commission on Homelessness. And before this happened, one of our priorities is looking at the disparities within the homeless assistance system, the systems we work, what are the barriers for people ending their homelessness, and why did they end up experiencing homelessness? And so to me, the role of a nonprofit now that provides very hands-on direct services where we're seeing this on a day-to-day basis is to raise the awareness and to let everyone know what we're seeing, but also to advocate, I think, for a change in systems so that we can bring in the public health dimension into the work that we do and do it early on, not as after a pandemic takes place. We did realize, and I just want to say thank you, C. Marie, for the program that you're offering. My 3 staff who are part of it are just, it's a very deep learning experience for them. And there are people who, we're all very progressive and think that we know how to address these issues. But I think having a concerted effort to focus on it. But we realize as an organization, we can do the advocacy for systems change, but we really need to do that hard work internally so that we can practice what we're preaching. So thank you so much for that opportunity.
Thank you. Yeah, because you've got to start internally, right, before you can go anywhere else. So I appreciate that. Carmen, you want to give us the next question? Amy, we're going to pivot to you first.
Sure. What are some of the things that enable nonprofits to respond in a crisis quicker and more differently than the government?
That's a really good question.
It is.
Yeah. I would like to say that most nonprofits were forged out of a need that they saw in their community or a gap. And in addressing that need, they had to adopt certain principles like flexibility, like awareness, like a connectivity to their stakeholders. And while there is that level in government or in the public sector, I think typically the mission-driven approach of nonprofits allows them an opportunity to explore a variety of activities or a variety of programs to best meet the need. So for example, if we are working with a group of folks in a classroom-based activity, and we realize that what would be better would be a more individualized approach, we have the ability to be flexible as long as it is kind of within the mission. And I think a lot of the panelists today have really talked about kind of that mission and that drive and how that is a motivation for connectivity, for engagement, and for long-term action. And I think nonprofits can be part of that bigger system and become over time very large and kind of bureaucratic. But I still think at the core, they have that ability to be nimble and to react to the change and to work towards their mission in a focused way that perhaps governments cannot. And I think it provides a unique opportunity right now to link to some of the issues that we've talked about during this session around some of the disproportionality in history, about some of the systemic issues. It allows being outside that public system to advocate in a different way, to build engagement among all levels of actors, and to really think about this in a long-term change way as opposed to just the here and now. And so I think we have a very important role to play. I think we have a even bigger role to play if we think about doing it together and as a collective, rather than any one single institution trying to do all of it themselves.
Yeah, I agree. I mean, I feel like this is the time right now. If we can't figure out ways to collaborate better and differently, then I don't know when the time is. This is the time to figure out, as you guys were saying, how to leverage and change, right? Someone said, you know, how to different roles. And so this is the time that we can all collaborate and figure out different business models so that we can all work more effectively together. I think we've got one more question in the queue we're going to try to get to.
Sure. What have you learned about yourself as a leader that has surprised you during this crisis? During this crisis.
All right. Thank you. So I'm going to have you each answer that. We'll start with you, Marilyn, then we'll go to you, Susie, and then Amy. And then I'll answer it too.
Okay. So I was on another Leadership in Action call with Dr. Pollard the other day, and this has stuck with me throughout these past weeks. She said that as a leader, you absorb the chaos, project calm, and build confidence in your team and those around you. And I have to say that I have been in times just in the chaos. So it's recognizing that, you know, we as leaders, that we have to acknowledge that we have to take care of ourselves, and that then we can take care of our teams and those that we serve. And so I think that it's really just, I've learned about how I can keep myself centered, acknowledge when I'm feeling the anxiety, because the anxiety is there. I'm actually participating tonight, being as a participant in a screening called Angst that Every Mind is doing. They're one of our partners. And I think it's really to understand that we're all going through this together and that we're all dealing with some level of anxiety. But what I have learned is that I can acknowledge that and I can address that and be present for my teams so that they see that as a leader, I can project that calm, I can find ways to provide support, I can connect them to support if I can't provide it myself. And so those are the things that I think about as a leader. And the other is really just to be grateful. To acknowledge that there are people who are suffering from this COVID-19 crisis. If you think about it, with the food services industry, they are providing 75 to 500% above what they'd been doing before in terms of trying to get food to people who were already food insecure and now are newly food insecure because of the COVID-19 crisis. And so every day I remind myself how fortunate I am and how I can use and leverage my own influence to provide support to organizations that we partner with.
Thank you. Okay, so we've just about 3 minutes left. So Susie?
I'll make it real quick. I want to concur with everything Marilyn said. I think there are two things that stick out for me. We, as Amy said, are very mission driven, and I have just seen this amazing call to duty by all my staff rising to the occasion because we all care so much. And it's been a great leadership development opportunity for my staff and for me to step back and give people opportunities to step forward, and they are just going above and beyond the call of duty. The other has been, like all of us, I've been, you know, in my field since 1985, and I have a deep passion for the work that I do. And I will say that I'm learning to feel comfortable in my skin of advocacy at the same time of being calm and providing guidance. I have been, I will put it out there, I have been accused that, or the organization has been accused for being hysterical because we have brought some issues to the surface that we feel needed to be addressed, and they had been accumulating over the period of time. I do not interpret it as hysteria, I interpret it as raising awareness. And so I feel very comfortable in that role now, that it's an essential role for us to be playing.
Thank you. Amy?
It's hard to come up with just one thing, so I will concur with what everybody else said. As a side anecdote, I think I have learned how many hours at a time I can live with those little buds in my ears. All of us are on calls and Zoom way more than before.
Yeah.
So I've learned that. I've learned to really draw energy virtually from a good conversation with someone else, and kind of being present in that conversation and drawing that energy I have found more than I thought I would be able to. But I think one of the things I've learned as a leader in this is this odd moment has provided a space to take a step back, to reflect in a different way on what we're doing and how we're doing it, to think creatively, to think innovatively, to think about new solutions, new programs, new activities, to come back not only recharged despite kind of the anxiety that this time brings, but with a clear focus on the mission while at the same time thinking of new ways to better achieve it. How can we be focusing on the bigger impact given the bigger demand, but to do so with this thinking big mentality? And I think that pause that we've been given in working virtually has allowed us that moment to kind of step back a little bit and think big. And the other thing is I've realized how important it is in the midst of this time to find moments that make you laugh.
Yes, absolutely. I believe in that so much. And laughter is a cure-all for everything. I think I've learned many, many things. Personally, I have learned that I'm tired. I am exhausted, and I'll tell everyone in the world because I believe in truth and transparency and vulnerability, because that's what makes a good leader. So I will tell everyone here, I'm exhausted. I took yesterday off so I could be really present with you all today. And so I've learned to be able to say that I'm tired, and it's okay. I took a day off, I'm back, I'm in it to win it, and if I need to take another day off next week, I'll do it, because that way I can come back. And so I've learned to say what my truth is, right? And to keep pushing forward. And I feel like as leaders, sometimes we just don't say it. And that doesn't help everyone. It doesn't help to not be completely honest. And so that's one of the things that I knew about myself, but it has been really forced out in these last 6 to 8 weeks or 12 weeks or whatever it's been. I don't even know anymore. And I've learned that I have more room. I'm a pretty grateful person, but I have more room for gratitude. And I'm seeking it every single day. And I think that's the thing that's going to carry me through. So I'm grateful to everyone who stayed on the call. We're a little past 12. I'm grateful to you all on these collaborations. I want to thank everyone who joined us today. Thank you all for all the work you're doing, because I get it. I've been doing this work with you for over 25 years. And so I thank you all. Just a little bit about Leadership Montgomery. We're continuing this series. We have 2 more. We're going to talk about the government sector next week. Then we're going to do a cross sector for everyone the week after that. We're going to continue this work around race equity. We're starting our next program in June, whether it's virtually or in person, far apart from each other, but together in this work. And we're going to hopefully have our fall programs in September. So we extended that deadline for our leadership programs. So, because we want you to think current and future. And so those are the things that are happening with Leadership Montgomery. We thank everyone who joined us today, and we will see you next week. Take care, everyone.
Thank you.
Thank you, Marie. See, Marie.
Thank you so much.
Thank you, all of you.
Thanks, everyone.